Welcome to the AQuity Solutions session for the 2020 Virtual Arch Collaborative meeting. My name is Dale Kivi, and I'll be serving as your moderator for today's session. And my background, I've been in the HIM industry for 30 years. I served on the Medical Transcription Industry Association Board of Directors and continue to serve as the editorial advisory board for the Record magazine. Joining us is Lori Stonecipher, Vice President of Clinical Informatics at Community Health Network in Indianapolis. She led the clinical informatics team comprised of providers and nurses for the past 5 years. Prior to the informatics role, Lori was the Epic Ambulatory Director at CHN, where she co-led the Epic implementation for over 250 ambulatory locations. Lori has worked in the healthcare industry for over 20 years and received a bachelor's degree in computer information systems from Indiana University Kelley School of Business and a master's degree in business administration from Indiana Wesleyan University. We are also joined by Mark Gum, General Manager for AQuity's Virtual Scribing business. Mark has over 20 years in healthcare IT and services, working at the forefront of change. In driving our scribing business, Mark is focused on improving physician wellness, as well as helping our clients deliver better clinical and financial results. Today, we're going to discuss physician burnout and how virtual medical scribes have proven themselves to be an effective remedy through research done by the AMA, HHS, and of course, KLAS Arch Collaborative.
Thank you, Dale. Happy to be here.
Thank you, Dale. I look forward to it.
Let's begin with the impact of burnout on physicians and the industry as a whole. Physicians presently work 11.4 hours a day, with 5.9 hours of that time spent engaged with the EHR. That's a result of a study with the AMA Practice Transformation Initiative and the University of Wisconsin Health. That's a whole lot of time spent engaged with something that does not directly impact the relationship between them and their patients. Physician suicide rates are now twice that of the national average, and this burnout crisis contributes to more than $4 billion in annual lost productivity. Burnout symptoms are reported by 44% of physicians nationwide and has become a critical issue that we need to address. Taking a deeper look at the AMA Practice Transformation Initiative, they did a study of 15,000 physicians covering 29 specialties to look at the specific causes of burnout, the top 10 causes, the top 4 of which all relate to the EHR burden on physicians and how it negatively impacts their relationship with their patients. If you focus in on the top 4 causes, too many bureaucratic tasks related to paperwork, spending too many hours at work, lack of respect as a caregiver versus a documentation specialist, and just the increasing computerization of their job. All of those directly relate to the EHR and can be addressed through virtual medical scribes. The support of virtual medical scribes through the AMA Practice Transformation Initiative studies have shown a significant impact in the reduction of burnout, as well as the improvement of clinical and financial results. The AMA Practice Transformation Initiative has actually conducted studies that look at all of the top 10 causes of burnout. A white paper is going to appear in the November issue of the Journal of AHIMA that I had written that specifically looks at how virtual scribes have been applied in some of those studies to the top 4 causes. If you're interested in a copy of that, feel free to send me an email, or obviously you can look at it in the Journal of AHIMA. Again, it's coming out in their November issue, and it will look at the top 4 causes of burnout and how virtual scribes are able to deliver not only reductions in physician burnout, but also improvements to clinical and financial results. If we look at some of those studies, specifically ones that have been published in the AMA Journal of Dermatology, you can see that when scribes are involved, it collectively reduces physician burnout. Providers report significant increases in their own productivity and their job satisfaction. 79% of doctors who were provided with scribes confirmed a willingness to see more patients, and 57% of the patients reported that they actually had a better experience with their physicians concerning FaceTime. In addition to all of the burnout benefits that are seen when scribes are involved, there's a number of business benefits that also come through. In one particular study, where there was a control group of providers with scribes versus a group that did not have scribes in the transition of their EHR implementation, they found out that the scribe-provided physicians resulted in 3,029 more RVUs from a total of 507 patient visits. That added 1.4 million in revenue at a cost during that period of the study of only $99,000. If Scribes can deliver 1.4 million in added revenue for only $99,000 in costs, probably something to take a closer look at. Now, obviously, that's a study from the AMA Practice Transformation Initiative, but now let's dig into what Lori Stonecipher and Community Health Network has experienced in applying Scribes for their business and the ARCH collaborative data that supports it.
Thank you, Dale. Community Health Network embarked on this journey with AQuity and our Virtual Scribe program back in 2019. The number one reason that we pursued this was to improve our provider well-being. Community Health Network opened up the program to all ambulatory providers, so physicians and advanced practice practitioners. Community looked for ideal candidates who were struggling to complete their notes the same day and who were spending a lot of time outside of clinic documenting in the EMR. We also found that mindset was key. It was really important to find a provider to partner with where they were already using top of profession workflows and standardized workflows with efficiency tools in the EMR. We also looked for providers who were willing to invest the time with their scribes to set up the scribes for success in using their workflows and efficiency tools inside of the EMR to make it as effective and efficient as possible. By the end of this year in 2020, Community Health Network will have 200 of our providers partnering with Virtual Scribes.
That's a notable user base, Lori. What have you learned from their involvement with Scribes?
Dale, we found that the testimonials from our providers resonate the most. We love hearing directly from their experience, how it's impacted their personal well-being. We've heard such testimonials such as, "This is the best thing to happen to me in 30 years of practicing medicine." We've also heard testimonials such as, "It has helped me balance work and family time tremendously, and that I've regained my home life." To us, these are such profound statements and truly delivering on our number one goal of improving provider well-being. We've also had providers report more face time with their patient, which improves patient satisfaction scores. The providers experience less anxiety in the exam room because they're not worried about the computer and the documentation, and they're truly focused on their patients. They have more time with staff and colleagues for collaboration and less what we call pajama time, where they're not working outside of their clinic hours on EMR documentation. We feel that the documentation itself is improved and ultimately safer for our patients.
Those are some really impressive burnout relief statements, Lori. Thanks for sharing that. Can you share with us some of the measurements that you've used to try and quantify some of those concerns?
Yeah, happy to, Dale. Community Health Network has used many different measurements of how we're looking at the outcomes of our Virtual Scribe program. First and foremost, we are looking at provider well-being and overall satisfaction and experience. We've done this in a couple of ways. One, we have some internal provider surveys where we have gathered data from our clinicians, and we've also partnered with KLAS and their research services to do some data that we'll talk about here in a few more minutes. We're also monitoring patient experience scores through HCAHPS and Press Ganey. And Epic has a provider efficiency tool called Signal, and you can use Signal data specifically to look at the work after clinic time for each individual provider, as well as the time they're spending in the Epic EHR to know whether or not they're spending it documenting a note, placing an order, and so really have the opportunity to decipher some of that on where the clinician is spending the most time in the EMR. Last but not least, we're partnering with our HIM department to make sure that we're monitoring the quality of our notes as well. That's
a really broad spectrum of analytics that you're using to, see the results of Virtual Scribes. Easy to see while you're the VP of Clinical Informatics. That's a lot of data to process. Can you bring forth any of the KLAS analytics, the type of data that will give specific measurements for what scribes have done for your business?
Yeah, today I'd like to highlight the survey that we use for our providers to measure not only their well-being, but their EMR satisfaction. So I want to show you this graph today, and we'll start on the left-hand side, where we're going to look at 5 different measures that were part of this survey. On the far left side, these are the post scores that involved providers specifically who had a remote scribe. In the middle column, this was our pre-baseline data of all providers for these 5 measures. On the far right column, you'll be able to see the percentage and change of those once we measured specifically with the providers with scribes. A few of the key data points that I really want to point out is when you look at fulfillment and medicine. I think it's just absolutely outstanding to see that our providers with Scribe have 100% fulfillment back in medicine, and we attribute that to less documentation in the EMR. When you look at specific burnout scores, our score improved by 16 percentage points for those providers who have a remote scribe. It went up to 91% not being burnout, and that relates directly back to those testimonials of those providers saying this is life-changing. Specifically want to look at the after hours charting measure as well. So for that measure, we saw a 33% increase for those providers having remote scribes help with their documentation. They are now spending less time at home doing their documentation due to the partnership with their scribe.
Those are really strong gains and definitely within the KLAS Arch Collaborative data set and approach to things. Did you find any other KLAS Arch Collaborative data that helped support or justify your move to scribes and the value that they bring?
Yes, definitely, Dale. I'd like to highlight some additional KLAS survey data in regards to scribe satisfaction. So today I want to show you this graph. The green bars are strongly agree, and you will see that is the majority for each and every one of these data points for our scribe satisfaction. The second measure there, having a scribe improve my focus on patients, extremely high amongst the providers who participated in this survey. You also see high scores for the next one. The scribes enable efficiency, and they also help to deliver high quality care to our patients, which is so important. When you scroll down a little bit farther, you see the reduced my work stress time and provides more personal time. We also feel that these are very important measurements and happy to see those so strong in the agree and strongly agree categories.
Really appreciate you sharing your experience at CHN and such strong results, not only with the KLAS Arch Collaborative data, but really impacting the lives of the physicians who get a little bit of help.
Thank you, Dale. Very happy to participate today.
Now let's shift to Mark Gum, the General Manager of AQuity Scribing Services, and he'll share with us how we approach the market, how we measure scribe implementations with all of our clients. But I think it's best to get started. Mark, you've got a great analogy that I really appreciate in terms of physicians needing to focus on their patients.
Thank you, Dale. There's an interesting analogy that compares how a provider interacts with a patient while simultaneously navigating the electronic health record and creation of the clinical note and texting and driving. Certainly, it's pretty well known that texting and driving is detrimental to not only the driver, but also to others on the road. When you compare that to a physician who's asked to do something somewhat similar, which is to split focus between patient care and the creation of a clinical document. And certainly not all elements of that analogy are applicable, but the distracted nature of attempting to do something as important as treating a patient and driving a vehicle certainly have relevance.
Thanks, Mike. I really like that analogy because, whether you're driving or you're caring for patients, there's something directly in front of you that you really should be focused on. And trying to, whether you're text or changing your attention to, direct typing, it just does not provide the type of support for what it is that you're supposed to be paying attention to. So let's now shift, and if you could share with us how you see Acuity's approach to the overall market relative to Scribes.
Absolutely, Dale. When we look at structuring a program, there are really four key items that we're looking for. The first one is how do we attack the primary goal? How do we improve provider wellness, and how do we decrease physician burnout? Virtualization has become the new normal. Inside the healthcare ecosystem, it's very difficult to find areas that can be virtualized. Certainly, clinical delivery, direct interaction with patients is extraordinarily important and difficult to virtualize. Scribing services, interestingly enough, is easier to virtualize. It's the reason companies like AQuity began our businesses in virtual models. And it really boils down to flexibility, the ability for us to recruit the best talent as scribes and pair them with providers nationally versus the ability to recruit within a single zip code. Our ability to create coverage models so that we can ensure that absences of the scribe, whether planned or unplanned, do not impact the provider. The patient experience is superior with a virtual scribe because the scribe themselves don't sit in between the provider and the patient, creating a more intimate interaction. Providers that travel from facility to facility, the ability to take a scribe with them physically certainly would be impossible, if not very difficult, whereas it's seamless in a virtual model. And lastly, providers that work non-typical schedules, whether that is a shift in a schedule or whether that's just the nature of their month in and month out schedule, aligning a resource to that atypical schedule virtually is much simpler.
That's a great foundation, Mark, for how Acuity looks at the marketplace and the things that are important to us as we look to provide the optimum value for the providers that we support with Scribes. Can you take us a little bit further in terms of what we measure for success with our provider organizations and our clients?
Absolutely, Dale. Certainly, as we've spoken about, one of the major goals of any scribing program is reducing physician burnout and improving physician wellness. And so I'll start with the targets that are designed specifically for wellness. So the typical measures that we work with clients on as Acuity is increasing RVUs. We look for areas to increase patient encounters on a per provider basis. What we have found is that through Acuity's work with a customer, we can find 20% increase in patient encounters and up to 12% in RVU increases. And those things help substantiate and support the scribing program with its primary goal of improving physician wellness. As many of us have seen, and Dale has spoken to, the AMA survey and studies have shown that the cost of turnover for a provider is between $800,000 and $1.3 million, and that's just the turnover costs. And so our ability to impact that turnover cost through improved physician wellness has a significant financial return.
That's some great stuff, Mark. Really appreciate you sharing our approach and the types of things that are important to Acuity as we try to deploy our scribes. To wrap things up, what are the expectations that our typical clients will see when we engage our scribe program?
Yeah, thank you, Dale. From a provider perspective, our goal is to eliminate after hours charting for the provider. And we expect you to see 99% elimination. There are several specific financial considerations as well that we measure, and we know they're important as part of the funding process for a scribing program. 98% same-day chart closures is certainly our expectation. We see 12% increases in RVUs. We typically are targeting 20% increase in patient visits on average, and these measures help support the program and ensure that the program can be viable and meet its ultimate goal, which is to improve physician wellness and reduce physician burnout.
Really appreciate it, Mark. Those are the types of metrics that probably everyone watching this video would be interested in. 99% elimination of after hours work, 98% same day chart closures, 12% increases in RVUs, and obviously, depending on specialty, 20% increase in the number of patients that are seen. Really appreciate everyone spending some time with us today. Mark, thank you. And Lori, thank you very much for joining us.
Thank you, Dale. Thank you, Lori. I've enjoyed the time together. And thank you to KLAS and the Arch Collaborative.
Thank you for having me. I really appreciated the opportunity to tell the story of Community Health Network and our Scribe program in partnership with AQuity Solutions.
Thanks for your time. America is in the midst of a growing healthcare crisis. Physician burnout has pushed physician suicide rates up to nearly twice that of the general population and contributes to over $4 billion in lost annual productivity. Experts agree that the effort to comply with complex regulatory requirements, burdensome documentation rules, and time-consuming demands of suboptimal technology are at the root of the problem. Since the move to certified EHRs, study after study confirm physicians now spend more time facing their computer screens than their patients. Due to the inevitable impact on patients, the 21st Century Cures Act was passed to find ways to improve the quality of patient care by addressing the growing problem of documentation overload. To aid in that effort, the AMA recently launched a 3-year, multi-million-dollar practice transformation initiative to identify actionable solutions that specifically address physician burnout. For their part, technology vendors have been developing countless productivity improvement tools to try and minimize the problem. Unfortunately, what they don't seem to understand is you can't cure physician technology burnout with more technology. As it turns out, the cure to physician burnout is already available and easy to find if you follow the money, specifically the AMA Practice Transformation Initiative grant money. Ongoing studies are validating that physician burnout can be effectively minimized with virtual medical scribes. The benefits of a well-run virtual scribe program are undeniable. When providers are relieved of their document creation efforts, they get their life back. FaceTime with patients go up by more than 50%. Patient volumes can increase by as much as 20%, depending on specialty. RVUs jump by over 12%, and billing offices see as much as 98% same-day chart closures. And since the cost of scribes are more than offset by the added patient volumes and increased revenue justified by the resulting improved documentation, the move is simply good business. Technologies will come and go, and sometime in the future, applications will become available to help physicians efficiently create accurate, comprehensive documents independently without causing burnout. Until then, virtual scribes from AQuity can deliver those results to you today.
AQuity Solutions for Smarter Healthcare.